Now we have 10 minutes before we move on to our final session with the panel. So Anna and Atisha would be happy to answer any questions that might have come from either of their presentations. Thank you. Just walk around with the microphone. Thank you.
Thank you. My name's Dave, I'm from Barnardo's. It's a question to Dr. Young in relation to the lesson plans and training that are currently being developed for year 7 to 9. Now, I understand that the bid was out and it's been awarded. My understanding is they'd only been given 2 months to develop these resources. Realistically, do you feel that that is a long enough time to actually develop such comprehensive and complex resources for training and lesson plans?
I feel like this is on. Yes. I think that's a good question. To be honest, I don't know so much about the Welsh Government tender or how long people have to develop the resources. My understanding, I guess, is that they would be based on resources that are already out there, likely to already be being used. I think the difficult thing, certainly with even the recommendations, is that the AOLE, the Health and Wellbeing AOLE, is all progressing so quickly. We're sort of all working under the really tight time constraints, and it would be ideal to have as long as possible to be able to, develop these, test them, feasibility test them, acceptability test them. In my eyes as a researcher, I'd want a randomized control trial of them as well to make sure that they really were effective. That's just me. So I'm afraid I don't know the sort of true answer to that. I don't know if anyone else here does.
We've been waiting for sort of 20 years for stuff to come in relation to PSE and stuff like that, and for it all to be updated. It's just that I would have been part of the bit of writing that for Barnardo's if we got the contract, and my huge concern was that we would only have 2 months to do that, and I feel that they're just rushing it through.
Yeah. I can understand your concern, yeah.
Malcolm.
Thank you. Malcolm Moore from Public Health Wales, manager of the Public Health Network. Welcome, everybody. Anna, I'm sorry to put you on the spot again. I had a question about the SRE. Historically, as I understand SRE, one of the issues for SRE is about who delivers it. There's always been an issue about many teachers feeling uncomfortable with it. That's partly being addressed by the look of it through training. But I wondered about whether in the expert group there have been discussions about other parties being part of the delivery system, so particularly external partners, whether that's people from certain communities who can come in and talk about their experiences, or third sector organisations, maybe like Barnardo's or Terence Higgins Trust or whoever. Was that part of the discussion?
Yeah, absolutely. So part of the SRE curriculum reform, and one of the recommendations is about the whole school approach. So this would be sort of curriculum delivered maybe by teachers, it may be by external organisations, but also that there would be that whole school approach. So it wouldn't just be, in the curriculum, it might be in sort of wider aspects. So it could be, policy related, it could be via assemblies, it could be by, student action groups, student voice groups, and certainly that would involve, liaising with external organisations, who do excellent work, and we should absolutely be integrating into the whole school approach.
Do you have any final questions or thoughts? Adam.
Hello, it's Adam again from Public Health Wales. It's just a comment really, and following on from Letitia's presentation, that what strikes me from it is that we sometimes forget that the cohort that we might be dealing with on a day-to-day basis in services may not be from Britain. So it's about remembering the experiences they might have gone through in their home countries. I just thought it was worth reflecting on that really.
Thank you, Adam. That's such an important point you make. I think there's a beautiful Cochrane review out on the experiences of migrants and asylum seekers and LGBT people and what they might have experienced in their countries of origin. as a result of their sexual orientation or gender identity. And for some people, when they then arrive in the UK, you know, they might be traumatized as a result of experiences in their country of origin, but also then to be able to seek asylum in this country, we ask of them to come out. So for some people, it's kind of a highly complex process, and they also live in that tension about keeping their identities private because of their experiences in the past, but also then coming to the UK where there's a different maybe openness and willingness to talk about gender identity or sexual orientation. So thank you.
Thank you. I'll bring this session to a close now by thanking Honor and Letitia again for, again, two powerful, thought-provoking presentations, and I would ask you to show your appreciation for them.